Let's begin. Okay, so bones we have been doing of the thoracic wall. So we did the sternum already. We also did the vertebrae, thoracic vertebrae. So the sternum is the part of the thoracic wall anteriorly, and the vertebrae, they are the parts of the thoracic wall on the posterior side. On either side, on lateral aspect of the thorax, the thoracic wall is formed by the ribs, right? So today's topic is the ribs, and mainly today we'll discuss about the typical ribs. So in the typical ribs, again, see, ribs, they're divided again into typical and atypical ribs. Okay, so why the ribs are divided into these two separate categories, we'll have to talk about that. We have to understand that. See, typical ribs, these share some common characteristics. All these ribs, they share some common characteristics. So this is rib number 2 to rib number 9. They are all typical ribs because they share some common characteristics. What are these common characteristics? We'll talk about them later. Now, what are the atypical ribs? See, number 1, okay, this is an atypical rib. We'll deal with the atypical ribs in a separate class. Okay, so the atypical ribs, they have some characteristics which are not similar to the common characteristics of the typical ribs. Okay, so all typical ribs, they have one head, a neck, a tubercle, we'll talk about this, angle, shaft, and a subcostal groove. Okay, in atypical ribs, the rib number 1 is short and flat. Okay, and it supports the subclavian vessels. We'll talk about this in a separate class. Okay, then, oh, this one is a mistake. Wait, I'll just correct this. Only 1. Okay. Okay, so rib number 1, rib number 10, 11, and 12, they articulate with only one vertebra. Okay, why this is important, we already discussed a little bit. Again, I'll tell you today, because last time we said, no, each rib, the head of the rib, it articulates with 2 adjacent vertebrae, right? So there is one superior costal facet and inferior costal facet in every thoracic vertebrae. Okay, but these ribs, rib number 1, rib number 10, 11, 12, they articulate with only one vertebrae. So that is why these are called atypical ribs. Okay, then number 11 and 12, they don't articulate with the transverse process. Okay, and anteriorly they don't articulate at all. So these are hanging ribs. 11 and 12, they only articulate with the body, they don't articulate with the transverse process. So this is why these ribs are atypical ribs. Rest, everything that the ribs share, these are common to rib number 2 to rib number 9. So these are the typical ribs. Okay, so the typical ribs are ribs number 2 to 9. Okay, and the atypical ribs are ribs number 1, 10, 11, and 12. And the function of the ribs is to reinforce the thoracic cage. Okay, so it adds strength to the thoracic cage. Okay, coming to the anatomy, again, apart from typical and atypical, there is one more classification of ribs, which is called true ribs and false ribs. See, the two are different. Okay, true ribs are the upper 7 ribs. Actually, the upper 7 pairs. Okay, rib number 1 to rib number 7. These are called true ribs because anteriorly they are attached directly to the sternum through the costal cartilage. Okay, so the anteriorly the ribs which are attached to the sternum through the costal cartilage directly are called true ribs. Then rib number 8, 9th and 10th, these are called false ribs. These are false ribs because they are not attached to the sternum, but these costal cartilages of these ribs, they are attached to the costal cartilage of the rib above. That means rib number 8 is attached to rib number 7, rib number 9 is attached to rib number 8, and rib number 10 is attached to rib number 9. Okay, so because of this, these ribs are called false ribs. Okay, this is separate from typical and atypical. Okay, among the true ribs, there are typical ribs as well as atypical ribs. Why? Rib number 1 is atypical rib. Okay, but 2 to 6, 2 to 7, they are typical ribs. Again, in false ribs, rib number 8 and 9, they are true ribs, but 10 is a false rib. Okay, so 10th is an atypical rib, 8 and 9th is typical rib. Okay, so true ribs and false ribs is a different definition. Typical rib and atypical ribs, again, it's a different definition. So you have to understand which to apply where. Okay, then there is another third type, which is the floating ribs. You know about this. This is the 11th and the 12th ribs, because they are called floating because they don't have any anterior attachment. Okay, so that's the diagram here. Okay, so as you can see, these are the true ribs. Rib number 1 is true, 2, 3, 4, 5, 6, 7. You can see the costal cartilages are directly attached to the sternum. Then rib number 8, here you see it is attached to the costal cartilage of 7. Rib number 9 is attached to the costal cartilage of 8, and the rib number 10 is attached to the costal cartilage of 9. Right? So these ribs 8, 9, 10 and 11, 12, these are actually false ribs. And among these false ribs, 11 and 12 are again called floating ribs. Okay? Remember, Floating ribs should be included in the false ribs. Some of them they say that only 8, 9 and 10 are true false ribs, 11 and 12 are floating ribs. Okay, but by definition the false ribs are all those ribs which are not attached directly to the sternum. Okay, among them again 11 and 12 can be called as floating ribs. Okay, so 1 to 7 are true ribs, 8, 9, 10, 11, 12 they are false ribs. Okay, so this is another diagram. So this is the relation of the ribs to the border of the heart. So this is a rough border of the heart. Okay, so apex, as you can see, it is in the first, second, third, fourth, fifth intercostal space, just medial to the mid-clavicular line. Okay, so this is the apex of the heart. This is also called the mitral point, or the surface marking for the apex of the heart. Okay, so you'll be taught about this later. Okay, so fifth intercostal space on the left normally. Okay, so what are the characteristics of a typical rib? Okay, so it is long, twisted, flat bone having a rounded upper superior border and a sharp, thin inferior border. So I'll show you this in the video. Okay, then the inferior border overhangs and forms the costal groove. So this costal groove is something. Okay, I'll not go into this theoretically. I'll teach you this on the rib itself. Okay, remember it has different parts: head, neck, tubercle, shaft, and angle. Okay, so we'll go into this one by one. Okay, so these are the parts. See, this one is the head. The head has two demifacets. Okay, so this one, the lower one is bigger and it articulates with the corresponding. So this lower one, it articulates with the body of the corresponding vertebra. That means if this is the fourth rib, then this lower facet will articulate with the T4 vertebra, and the upper one will articulate with the T3 vertebra. Okay, and this apex, in this area in the middle between the two facets, it articulates with the intervertebral disc. Okay, we'll show this in another diagram. So this is the head. The next part is the neck. This area is called the neck of the rib. Then this part is the articular part of the tubercle. This whole thing is called the tubercle of the rib. This articulates with the transverse process of the corresponding vertebrae. Okay, this articulates with the transverse process of the corresponding vertebrae. Then this whole thing is the shaft, or the body of the rib. Okay, and in the body of the rib you will see that the rib sharply, at one point the rib has the maximum curvature, after which it turns anteriorly. Okay, first the rib actually goes posteriorly, then it turns and goes anteriorly, and at that point where it turns anteriorly sharply, this is called the angle of the rib. Okay, then the rib has two surfaces. This is the outer surface and this one here is the inner surface. So in the inner surface, in the lower border, you will see that this part is called the costal groove. Okay, just underneath the lower border on the inner surface, this is called costal groove. And the rib itself has two borders, a superior border and an inferior border. And remember, the inferior border is sharp. Okay, that is how you demarcate the side to which the rib belongs. Okay, this is the posterior end, this is the anterior end, this is the outer surface, this is the inner surface. One superior border which is rounded and one inferior border which is sharp. So these are the points for side determination of the rib. Okay, this is another diagram, the same thing. Okay, now that part of the head of the rib which is intervening between the two facets is called the crest. Okay, this area which articulates with the intervertebral disc is called the crest of the rib. And of course the anterior end of the rib, it articulates with the corresponding costal cartilage. Okay, so these are features of the typical ribs. Okay, these are features of typical ribs. It will have two facets, but rib number 1, 10, 11, 12, they don't have two facets, they have only single facet because they articulate with only one vertebra. That is why they are called atypical ribs. Apart from that, they don't their features are not so sharply marked. Okay, and also ribs, they are flattened medial to lateral, in this way, in the medial to lateral anterior posterior direction, but the first rib is flattened in the superior inferior direction. I'll talk about this when we discuss the first rib again. Okay, so atypical ribs, see, the first rib is mostly clinically important because it is closely related to the lower nerves of the brachial plexus. Okay, we'll talk about the atypical ribs, or mainly the first rib, in another class. We have one more class for the first and second rib and another class for the 11th and 12th ribs. So those ribs we'll again discuss. Okay, so I'll not go into the details of that today. Okay, so this is the atypical rib. This is the first rib actually, and this is rib number 12. As you can see, it has only one facet, not two facets. Okay, and obviously this is very different from the typical rib, right? So as you can see, it's gradually curving around to form the shaft. But here the shaft is sharp. The shaft is sharply demarcated. Okay, so typical rib articulation. So superior demifacet and inferior demifacet. Okay, then there is a tubercle. We already talked about this. So this is the attachment. Okay, like I told you, if this is the fifth rib, okay, if you take a cross section, then this is the appearance. You have a costal groove on the inferior side, and the upper border is smooth, lower border is sharp. Anteriorly, you have the costal cartilage through which it is attached to the sternum. Then posteriorly, you see this is the tubercle of the rib, which articulates with the tip of the transverse process. Then there is the head of the rib, which has two demifacets. One which articulates with the corresponding rib. Okay, so this is the fifth rib. It articulates with the lower facet articulates with the fifth thoracic vertebra, and the upper facet articulates with the fourth thoracic vertebra. And the crest, I told you this part is called the crest. Okay, area between the two articular facets is called the crest. This crest articulates with the intervertebral disc here. Okay, so this is the typical articulation of a typical rib. Okay, so this is from the superior direction. This is the tubercle of the rib, where it is attached to the transverse process. Then here it is attached to the head of the rib. To stop the presentation, I'll do on the rib itself. So this here is the rib. Okay, so you can see this is twisted. This end is at the upper end. Okay, so this is the anterior end, which is at the lower end than the posterior end, which is at a much higher level. Okay, this is because the rib slopes downwards. You can see this is twisted. Right, this is not the two ends, the anterior and the posterior end, they are not in the same plane. Right, this is twisted, the rib, because the rib from the posterior, from the vertebral column, it first goes downwards. Okay, then it twists to the anterior side. So these are the parts of the rib. This is the head. It has two facets actually, one superior facet and an inferior facet. Okay, the inferior facet is bigger, which articulates with the corresponding vertebra, and the superior facet articulates with one vertebra above. Okay, so between the two there is so you have the crest, and the crest it will articulate with the intervertebral disc. Then you have one upper border here. This is the upper border, and this here is the lower border. You can see that the lower border is sharp. Okay, the lower border is much sharper compared to the upper border, and in the lower border this groove that you can see on the inner surface, this is called the costal groove. Now this costal groove, it contains the intercostal artery, vein and nerve, and the arrangement is vein, artery, nerve. That means most superior is the intercostal vein, then you have the intercostal artery, and most lower you have the intercostal nerve. Okay, so all this intercostal neurovascular bundle, it travels through this intercostal groove. Now anterior end, of course, it articulates, it gives attachment to the costal cartilage through which it attaches to the sternum. On the superior border surface, on the superior border, you have the attachment of the three intercostal muscles: external intercostal, then internal intercostal, and innermost intercostal. Okay, this goes from one rib to the other rib, the rib above. Also below you have this inferior border is sharp, and this costal groove also has two borders. Okay, the lower border and upper border. So to those three borders, these muscles are attached. So in the most apex of the inferior border, you will find the attachment of external intercostal. Into the floor of the groove, you have the attachment of the internal intercostal, and in the innermost part, in the upper border of the costal groove, you have the attachment for the innermost intercostal muscle. Okay, external, internal, innermost. And this neurovascular bundle, it lies between the internal and the innermost intercostal muscles. Okay, so that's it about the ribs. So this one is a typical rib. How to do the side determination? First you see anterior and posterior end. This is the posterior end. This one is the anterior end. So this is anterior, this is posterior. So it can be like this, or it can be like this. So how you will decide that? Okay, so you have to see the upper border is smooth and the lower border is sharp. Whichever is the sharper border will be below. So if I hold it like this, then the upper border will be sharp. So this is the knot of the rib of the left side, right? So you have to just make sure that the upper border is smooth and the lower border is sharp. So this is a rib of the right side. Okay, anterior, posterior. Of course, medial, lateral is easy. The convex surface is the lateral surface, and concave surface is the medial surface, right? So anterior, posterior, medial, lateral, superior, inferior. This is the rib of the right side. And to see if it is a typical rib, the easiest thing is that to see if the rib is twisted. Okay, so if you put it on a flat surface, then If one end is touching the surface, then the other end will be lifted above. Okay, so the two ends will not lie in the same horizontal plane. Okay, one end will be in a little bit in a level above the same horizontal plane. So if the rib is twisted, it's a typical rib. Okay, that's it. Thank you.
Thank you, sir.
Thank you, sir.
Chalo, bye bye.